Hey everybody. Okay, let's see. How can I invite Dr. Solt? Okay. All right. Hey everyone.
Hey, we're in. Let me
Hello.
adjust my, there we go. Can you see me now?
Yes, I can. How are you?
I'm so good. How are you?
Good, good. Hey, Dr. Kilt is in the house. Hey everyone. All
Yay.
right. We've got everybody, and I have a list of prepared questions, and I'm going to keep them handy just to make sure I ask you everything that I need to ask you. Hi, everyone. Thank you all for joining us. Me and Dr. Salt are going to be discussing all things, well, mainly Dr. Salt is going to let us know all things about anti-aging and regenerative medicine, and also a sprinkle of carnivore here and there. So I'm excited. Dr.
Me
Sabrina
too.
Solt, I'm so excited to meet you. Hi and welcome.
Same. Thank you so much for having me. I'm so glad we got to connect. I think this is going to be fun.
I know. So, can you share a little bit about your background for everybody so they have a brief overview of what you do and also a little bit about your carnivore escapades?
Yes. Okay. So I'm a naturopathic medical doctor. I practice here in Scottsdale, Arizona. And my practice is mainly, as you were saying, regenerative and anti-aging medicine. So basically helping people look and feel a lot younger than they actually are with a lot of natural therapeutics that are super, super effective. I started carnivore back in about January of this year, so going on about 9 months or so. And
Okay.
I started actually after watching my husband get into it, and he started because he had some health stuff going on, and he just basically dove into a lot of people who were spreading the message on YouTube. He started trying it out. I thought he was completely crazy. I was like, how can you ever survive without vegetables? Like, it just didn't make any sense to me. And then I started seeing his results in real life, in real time, and the whites of his eyes were getting super white. His skin was like super dewy and clear, and just he had all his energy. His mood was super even. Like, it was just a complete change, really, really fast. And I was like, okay, there has to be something to this. I started trying it out for myself, and the first thing I did was I just kind of cut out salads, and that made a massive improvement. I was like, all right, we have to go a little further. And then the last two things that I cut out of my diet was white rice and oats. I was eating those because I was still nursing. I'm still nursing my youngest, and I thought that I needed like the carbs and the calories in order to make more milk. And then, of course, proved to myself over time, nope, actually don't. And now I've been what I'll call like hyper carnivore, mostly carnivore for a while, probably at least the last 4 months, 5 months or so. And it's been the best thing ever. I do small amounts of fruit here and there, but it's certainly, I would say greater than about 80% of my calories is all animal based.
Wonderful. What are some of the benefits that made you get convinced that this is the best diet for you?
So I require less sleep now. I used to be the person that I would like very easily and very willingly sleep into 8, 9 o'clock, which is really late. Now I wake up usually around 6 or so, ready to go. And that was a stark change for me, just realizing, okay, my body actually needs less sleep to be able to do the heal and repair that it's going to do. My
Right.
hair grows like a weed. My nails grow so fast. My digestion improved dramatically. My skin, I get compliments on my skin all the time. And of course, just you feel good. Like you just feel really, really good. And I mean, can't
Yeah.
express it enough. I feel like you just have to try it for yourself to really see. But
Yeah.
it's just like a whole new level of existence.
Yeah, and I get exactly what you said because I feel when you come from an academic background like you and I, we're so brainwashed. And it's like we have the hardest time converting into a carnivore because it's like we've been bombarded with this study and that study and all that kind of thing. And then they don't tell you that those are all epidemiology. This is like the lowest quality of evidence possible. And it is cherry picked by the Academy of Nutrition and Dietetics, who is literally in bed with the food companies. And not because it's like this giant conspiracy, but it just so happens that there are a lot of dietitians that it doesn't bother them to eat plant foods, and maybe it does, but they never make the link between the rheumatoid arthritis and the fact that they're eating the salads, because there's no way that that could be the cause, right? And so they actually truly believe that that's a healthy food. And if you believe that, salads are good and oats are good, why not partner with Kellogg's, and have the oat bars? It's high in fiber. So it's like they really believe it. I'm not like this conspiracy theorist is like, oh, they're like all getting together and they want us all to be sick, but
I'll go like a little further on that, because you say, oh, it's not necessarily a conspiracy, but Kellogg himself and the Quakers, they actually started making things like graham crackers to subdue libido, right? And if you think about humans in general, we're fancy animals, meaning our main drives are to feed and to find family and to do the other F word, right? So if it's one of our basic primitive drives to do things like that, and they're trying to subdue the libido, you have to then extrapolate that, of course, these foods are going to have an overall net negative on our health by consuming them if they're subduing one of our most innate human drives or animal drives. Yeah. So that's not even a conspiracy. Like, that is a real fact. And you'd think, like, clearly things haven't gotten better, right? It's clearly gotten worse.
Yeah, like you said, Harvey Kellogg's was literally paid for by the Church of the Seventh Adventist to become a doctor. And he was like one of them, very religious and truly believed in the ideology and the fact that the whole church believed that a plant-based diet is optimal. And the reason they believe that is because, like you said, it subdued the urges to masturbate, and they believed that masturbation was a sin. So this is exactly what we want. We don't want you to have any hormones. We don't want you to have any urges. And then the cool thing is that, or the wild thing is that, he goes and sets up the Battle Creek Hospital, which was one of the most well-known hospitals in the world. Celebrities would go there, everybody, right? And his head dietitian, Lena F. Cooper, she obviously is also the Seventh Adventist, pushing vegetarian diets. That was what they offered in the hospital. She goes on and co-founds the American Dietetics Association. This is what it was called then. Now we call it the Academy of Nutrition and Dietetics. I mean, you can't make this stuff up. To this day, this whole idea that, I mean, if it's coming from the heads of the Academy of Nutrition and Dietetics, of course, I mean, that's the leadership, right? Everybody's going to think, yes, that's the authority figures are telling us plant-based is the way to go. So we're only going to look at those studies. Not only that, the Seventh Adventist Church is also supporting the Loma Linda University and Hospital, where they're choosing to pursue research that aims to show how a plant-based diet is superior. So to this day, they're pumping out studies with the same hypothesis: plant-based better, but that's because they already have that inherent bias. So of course, if you're comparing a junk food diet to a plant-based diet, what do you think is going to win? You tell me. Right.
And that's exactly it. It's completely skewed in the sense that, okay, if we're talking about the standard American diet, any variation off of that highly processed stuff is still going to be generally a net positive for the person that's doing it. But that doesn't also mean that that's the most optimal diet. And if we're trying to talk about, well, what are the factors that would constitute a healthy diet, or what are the results that you would do? I mean, if they're in these studies, they have to do measurable things, right? They have to measure markers. They have to have what we call objective data, reproducible objective data, in order for it to be a quality study. And if you start distilling just humans down to just simple biomarkers without actually looking at the whole thing, and especially over time, I don't think you actually get a true representation of what they're trying to do. So, example, some of these studies, they'll look at and they'll say, oh, did this diet reduce cholesterol? Well, we know that actually having a low cholesterol contributes to earlier morbidity and mortality in certain populations, and it's not always necessarily a good thing for that to be lowered. But again, if this is what the head honcho people are telling us is a great standard of something to look at, well, all of these studies are going to be flawed when you're analyzing them against those things. So I don't even take stock of a lot of those, if I'm being honest. And I think that it's more important to just look at the person in front of you and say, are they healthy with what they're doing? Do they feel good? Do they have energy? Is their skin clear? Are they able to do all the things they want on a daily basis? How's their memory? How's their cognition? There's so many other factors we can study.
Exactly. For men, morning wood, as all of the other, yeah, doctors keep saying, energy levels, mental clarity, clear skin. I mean, if I had students who did carnivore and then completely reversed their psoriasis in literally 2 weeks, are you telling me that this diet is not the optimal human diet, right? Or I had another client literally got her period back. She was menopausal at 55.
Yeah.
We didn't even start her with bioidenticals or anything. Just by changing her diet, she got her period back. That's literal reversal of the aging process.
Yes.
So,
And so, okay, so this is actually a video that I'm planning on doing. So there's 9 hallmarks of aging, basically. And the hypothesis that I'm going to put out in this video is how carnivore affects all of them. Like,
ooh,
and I've scanned through them all. I think I can do it. It's gonna be like a really labor of love thing here, but I think it's gonna be such a really great perspective for the average person to see, in that you can control for healthy aging and a greater health span by just doing this diet change. You don't need to go spend the hundreds or thousands of dollars on the advanced testing or the crazy supplements or like whatever the newest biohack is. Like, just eat a carnivore based, ancestrally based diet, and you're going to have the best health you can possibly get. Just that.
I can't wait to watch that video. I'll probably do another IG live or another interview so that we can break them down. For me, I'm obsessed with that. We have a question from Sunshine Dutch. Any tips for rejuvenation and maintaining a tight neck?
Okay, so the skin on the neck is really interesting, and a lot of that is just due to simple collagen loss over time. I think we start losing, what is it, 1% of our collagen every year after about age like 25 or 30 or something like that. If you can do, if you can add more collagen-based things to your diet, of course, that's going to be helpful for actually increasing your own levels. But then other things like red light therapy is actually really, really great for helping to enhance collagen and that skin elasticity. But some people will have to opt for things like radiofrequency to actually really get that tightness back. Carnivore can help, of course. You're going to be giving your body all of the basics that it needs to actually do the rebuilding, like the essential amino acids.
Yeah.
But sometimes you have to hit the more heavy stuff depending on how old you are and how long it's been present. Yeah, I wouldn't. Some of the things that people actually do currently, they'll do like those threads. I don't love those for people for the most part. Not because I don't think that they work, but because oftentimes they're not a permanent fix, and I have seen it make a lot of things worse after a period of time. Yeah,
Right?
I would say red light. Have you seen those? The
No,
PDO threads? So
no.
they're these like barbed wire things that they put in the skin, and they're the same type of material as just like as a regular suture, but they have
Oh,
barbs on them. So they get inserted, and people do them in their face too, and it's a way of smoothing things out and stretching things and making things taut. But you basically, there's a hole, they put them in, they kind of come like this, and then the provider will pull them, it stretches the skin, and then the barbs in them catch, and then they stay in the body. And there are these like
wow.
almost semi-permanent suture things that will just pull the skin tight. But I've seen so many people afterwards where the longer outcomes from that, I personally don't feel are worth the short term.
Got it.
Dead. I'd much rather do the natural option of
Right.
possibly red light therapy, dietary changes, and maybe radio frequency if that's something that's available.
Love it. Okay, Sunshine Dutch, she says, thank you for your answer. You're very welcome. Okay, another question. Is RF a risk with thyroid? I guess radio frequency, is it? If have you
Not that
seen?
I'm aware of, but I don't think it should. Depending on the thyroid issue, I mean, if you have actual nodules on the thyroid, I would be cautious of anything going near it. But if it's just regular old hypothyroidism, I wouldn't anticipate that. That being said, if people are dealing with thyroid issues, 9 times out of 10, it's actually due to a mineral deficiency of some degree or some other nutrient deficiency. A lot of the population are super deficient in zinc, selenium, and iodine, which are the 3 key minerals that we need for healthy thyroid function.
Yeah.
So that's something that you're dealing with, I would possibly experiment with getting those nutrient levels back up as a way to help heal your thyroid. Carnivore does that, actually helps with that really well too.
Awesome. I do want to ask you more about radio frequency. I'm very interested in anything we have like tools at our disposal for anti-aging. But before, Sumaya Mustafa is asking, what will you suggest women of 34 year facing PCOS or hormonal issues with diet? You will suggest her life. That's easy. And I think that's another person asked us about PCOS. So guys, PCOS is literally just too much insulin. So cut out the carb. That's it, right? Insulin, when you have spikes of insulin all day long, it prevents testosterone from being converted into estrogen in your ovaries. And so that leads to a buildup of testosterone, which leads to all of the symptoms of PCOS, acne, hirsutism, cysts on the ovaries, and inability to lose weight easily, all that stuff. So yes, you can totally reverse PCOS. I think even people who love high carb will admit is like, yeah, even though high carb is great, but if you have PCOS, maybe that's not the best diet for you. So there's no controversy there.
No, I agree with that. Yeah, I agree with that 100%. The other aspect to the PCOS part is that, yes, of course, you are, you're not sensitive to insulin. You are overproducing androgens. But then the other aspect that some people don't really notice is that your liver is usually backed up as far as a detox method too. A lot of times in these types of patients, what I do see is that there really actually is an additional need to do some degree of detox to get the liver moving more, because it's actually the liver's inability to break down and conjugate that excess testosterone that causes it to build up with those other symptoms. Because of course you can have a healthy person and you can give them testosterone and they don't get the PCOS symptoms, right? Like they're not going to get the hirsutism or the other negative impacts of that. And of course, it is the insulin sensitization that plays the role on the input, but then on the excretion side, it's usually liver stuff. And of course, a lot of these people are also really constipated as well, and they're not having regular bowel movements. So they're not able to get the stuff out, and the body's actually reabsorbing things that are sitting in the colon. So all those toxins that should be leaving. And that's what usually shows up on the skin. And that's actually across the board too. Digestive issues in general almost always show up on the skin. If I ever have patients coming to me with, you're saying like psoriasis, people healing carnivore with that, because it's a gut issue, right? All skin issues are actually gut issues. So you have to start with the diet. You have to start with actually getting that stuff worked out really, really well first.
So do you do anything special for liver detox?
I love castor oil packs. I don't know if you guys are familiar with those, but they're so simple. You basically just take castor oil. It really helps with increasing circulation to an area. You rub it over top of where your liver is, where if it's on your own body, it's going to be on your right side, just kind of right below your rib cage. And rub some castor oil over that. You'll take like a thin towel or a thin sheet, whatever you have available, something that you wouldn't mind getting dirty, because castor oil is thick and gross and doesn't really wash out very much. And you'll just put a hot water bottle over top of that. And this is like one of those old naturopathic remedies that has been around for years, like hundreds of years. I'm certain of it. But you put it over top and you just sit there and hang out for like 30 to 45 minutes. The heat plus the castor oil will actually increase your liver's ability to dump stuff. The next day, people usually have a pretty good bowel movement, and I also usually like them to combine it with an abdominal massage that goes in the direction of the intestines. So again, if you're sitting here on your own abdomen, you would start on your lower right side, come all the way up, go across it with a light massage, and then go down with the descending colon. And that really helps to move things through. I find that people, sometimes their intestines just need like a reminder of how to do peristalsis, which is the movement. And the intestines actually do have basically motion receptors on them. This is why if you've ever experienced the diarrhea that comes right at the beginning of your period when your uterus is contracting against your intestine, that's what's happening. Those movement receptors are actually telling your colon to go ahead and have a bowel movement.
Love it. That's fantastic information. Thank you so much. And Sumaya says, thank you. You're very welcome. Okay. I have a couple of questions here that I think I went over. Let me see. Yeah, I think before you do anything, just change the diet first. Oh, Brenda, Klontig. Anything you can do to improve crepey skin on arms?
Depends how old you are. So crepey skin, I really do think that a lot of our skin issues start with diet, just like how we were just talking about. Getting more healthy fats in your diet. If you already are on carnivore, sometimes you have to increase that. Every single cell in our body, especially on our skin, is made of something called a phospholipid bilayer. And that double layer is basically the fats that we intake in our diet. That's what our body uses to build that. If you went many, many years eating kind of a standard American diet, eating a lot of things like seed oils or those other processed oils versus a natural, more saturated fat or animal-based fats, you're going to have a harder time with how your skin turns over. You might have thicker layers of keratin on the top part of it, which is actually going to contribute to that like hardness or that crepiness or that weakness that you're going to feel with that. So dietary changes, again, your skin will eventually turn over with the new healthy fats that you're having. But then you also might want to consider something like microneedling as well too. So I love microneedling for anti-aging purposes, and you can do it pretty much on any part of the body. And I love using something called PRP with it. Have you heard of that before?
Yes, I was going to ask you about it, so we can go ahead.
Okay, so PRP stands for platelet-rich plasma, and it's something that we get from your own body. So it's no more difficult than a simple blood draw. And the amount that we take is usually only about 1/10 of what you would give in a blood donation. So a relatively small volume. And we can put PRP pretty much anywhere. One of the things that we can use it for is making ourselves look better. So we can microneedle it into the face. There's a picture of Kim Kardashian many years back where she had gotten what we call the vampire facial done, and it was just like her face super, super bloody. And people either got like super interested in it after that, or they completely wrote it off. But the neat thing about what the microneedling does is it creates kind of tiny channels in the face, but also causes micro trauma. So the act of those two things happening will actually tell your skin to rebuild a little bit stronger with more collagen and elastin. But the micro channel will allow now a product to go in. And when we're using your own PRP, what we're doing with that is we're actually taking all of the things in your blood that are responsible for healing, for repair, and for growth, and we're putting them back into your face in high amounts. The results are so cool. We see acne scars go away. We see fine lines go away. We see more evenness, better skin texture, smaller pores, and it's really fantastic as far as a natural thing goes. You know, you're not going to get the lines going away the same way that you would if you were going to do Botox, for example, where that paralyzes the muscles. But again, this is your own natural look that your body's doing on its own, which I love.
Do you have information on how often that would be recommended just for like maintenance, just, you know, on top of the working out and on top of the carnivore diet, on top of everything we're doing already? You know, if we're like 40 or 50 and we want to have like an anti-aging protocol put together that includes microneedling with PRP, how often would you recommend that?
I usually recommend that people start with a series of 3 spaced about 4 to 6 weeks apart, and then once or twice a year after that for maintenance. So then it becomes pretty easy, but you want to get as much turnover initially as you can and kind of stimulate it as much as you can. And then again, the once or twice a year is super, super good after that.
And what is the budget? Do you feel like most people can get that? Like any advice regarding that?
It depends where you're going. Certain places are going to just be more expensive, and it depends on a couple different factors. One, it depends on what kind of kit the company is using and what at least their hard cost is on that kit. Some kits, just the kit themselves to do the processing, plus the sterile tip for the needles can go upwards of $100 to $200. And then it also depends who's actually doing your facial. Is it being done by an esthetician? Is it being done by a nurse practitioner? Or is it being done by a physician? And why this matters is because they're in certain states, there actually is regulations surrounding how deep a certain provider can go with the microneedling. So in certain states, nurse practitioners, medical assistants or estheticians, people who aren't like a mid-level provider or higher, they will actually not be able to go as deep as a provider would. So as a doctor, I can actually go max depth on my needle, and we can really kind of work harder on the face with that. And it also limits what product they can do. So again, you have to be a provider to be able to pull blood or do something like PRP, whereas if you're working with an esthetician, you might only be able to do like some sort of purchased serum, for example. So the results and the price can vary based on all of those factors, but I would expect to pay at least around $200 or $300 for a session.
Yeah, that's definitely way cheaper than what I had in mind. So that's definitely very affordable. Like if you really want to put together an anti-aging protocol, I feel that's totally worth it. You know, when the time is due. And do you suggest a certain age when you need to start doing those treatments?
Sooner the better. Honestly, it's not gonna be harmful to start it in, say, your late 20s. But now I always say now is always the best time because we certainly can't go back, but we can always, choose better moving forward.
Awesome. Okay, we have a question from Jonathan Alba. Hey, Jonathan, thank you for being with us. All right, here's the question. We are seeing reports of more heavy metals being found in the soil today. Do ruminant animals remove some of those metals better than humans? How can people avoid heavy metals? Do you want to take a shot at this?
I'll jump in that. So yes, ruminant animals can remove these better simply by virtue of the fact that they have four stomachs to do this digestion. Everything about them is much larger than us, so their ability to conjugate these, bind these, eliminate these are going to be much better. That being said, I don't know if there's anybody testing animals for heavy metals. I would imagine that that would get super arduous and expensive if that was something that was happening. So it's really hard to say if that's having any effect, but we can deduce that the animals are going to do a really great job of eliminating these things, if they're even present, right? Like if the cows truly are just eating a great deal of grass, it's going to be really difficult for grass in and of itself to take up heavy metals from the soil. They're really going to only be more apt to be taking up the organic versions of those minerals.
Yeah, I think you're right about that, and I think the alternative isn't any better. What's the alternative?
To not eat them?
Exactly.
Yeah.
Even if you're getting plant foods that are like completely organic, that don't have any additional pesticides in and of themselves, they have natural pesticides. As a matter of fact, there was a study back in the 90s, that's when we knew about this, that was published that showed how 99% of all pesticides in the Americans' diet actually comes from just plant foods, like natural pesticides, not added, natural. So,
I agree with that. Yeah, and it's people want to get in an uproar about things like glyphosate, but if you're not consuming plants, that's really not going to be a problem for you, or it's going to be quite negligible. That being said, it's still even in the water supplies and everything like that. And I say this not to fearmonger with people or anything like that. The flip side to this is that humans, our bodies are designed to do really great elimination. We have our livers, our kidneys, our colons, our skin, all of these things on our body that can eliminate toxins that our body doesn't need. And a healthy body will do that really well. So do I think that it is something that you should really be fearful of on a daily basis if you're relatively healthy? Not at all.
Great answer. I have another question from Rob Jen. Recommendation for preteen girl having acne issue on forehead.
Gut issues, 100%. She has to change her diet. And the unfortunate thing with teens is that not only are their hormones going wild, but they're probably eating anything and everything they can get their hands on, and it's usually not the healthiest stuff. So gut stuff has to be looked at with that. And then I don't know if this is something that applies to her, but usually around that age, young girls are sometimes put on birth control, so quote unquote regulate their periods. That birth control with those synthetic forms of the estrogen in it will actually cause an additional burden on the liver, like we just kind of discussed earlier. And that burden on the liver can also cause the skin stuff to come up as well. So diet stuff, liver healing stuff, and that would be the place to start.
And no unnecessary drugs, just go carnivore. And I get
no Accutane. Like, do not do Accutane. If you like your liver, do not do Accutane.
Did you know that I did 2 rounds of Accutane with no results? Yeah. I've done 3 months antibiotics. I've done another few months, maybe 3 or 4 months birth control pills. I've done 2 years spironolactone. Nothing to my skin like a carnivore diet. So, they don't work. Sumaya Mustafa, what will you suggest for large open pores on face? What best remedy or method to close the face pores, as I can't use ice on face because of sinusitis issue?
Oh, interesting. Microneedling does work really well for shrinking pore size. But then I would also just look at digestion and elimination in general, because there has to be another reason why your pores are wanting to be that size in the first place. What are they trying to eliminate? What's getting caught up in them? It's usually an elimination issue.
There you go. I've got another question. Good. I hope I can get to my questions too.
Yeah.
Nancy Kupia, thoughts on neurotoxin injections?
Oh, like Botox and stuff like that.
Yeah.
There are people that will say that Botox is really bad for you and it is a quote unquote toxin. I've had it done before. I am not against it. I think that in some people it's not well tolerated, but as a category, I'm not necessarily opposed to it. So I don't know if that answers your question,
Yeah.
but
So
everyone's different. Like everybody is different. I don't think that everybody can tolerate it.
you've had a personal experience with it.
Mhm.
And what are your thoughts after you went through that experience?
I've had no issues with it. In fact, my body actually clears it really, really well. Anytime I've had it, it doesn't last nearly as long as they say it should. And again, because I think that a healthy body can clear toxins very,
Right.
very well, very, very effectively. So it's again, it's fine. I think for me, it's been fine. For some people, it's not. There's plenty. I've seen Facebook groups with people where they've gotten really, really negative effects after having Botox. I also think that it's important if you're going to do something like that, go to a really skilled provider.
Yeah.
Don't go like there's just certain things like you don't shop for on Groupon, and somebody putting a toxin into your face is something that you like spend the money on. Like really just don't spend the
Yeah.
money on stuff that's going on your face because it could you could have disastrous results, of course. And I'm sure we've all seen the pictures of those people who have had, somebody like their eyebrow goes like way up here or something crazy like that happens. Or like droopy eyes. That's a side effect as well too. And then there's some people that will report that they'll get even systemic symptoms from the Botox, joint pain, neurological issues, things like that. And so this is actually part of a bigger conversation. So I used to have breast implants and I had those removed. And I attributed a lot of symptoms that I was dealing with to like the breast implant toxicity.
Right.
But so going back though, I wish that I would have known about the carnivore diet before I had the implants removed because I wonder how much of my symptoms was related to the healthy diet that I was eating versus the implants. And this isn't to say that they don't produce real symptoms in people, but it makes you wonder because you get the picture of the person that's getting these breast implants, and it's usually a young woman who is health conscious or body conscious and therefore consuming a lot of plant materials. And maybe she's doing alternative flours like almond flours or almond milks or nut milks or all of these other things that are entirely mostly plant-based. And then of course she's getting worsening symptoms, but then it gets attributed to the implants because oh goodness, how could it be the diet that I'm eating because it's so healthy? I eat a salad 3 times a day and I eat all these vegetables. And part of me wonders, was that actually the problem? Now, some of the stuff that I was dealing with did go away. So my husband and I, we were trying to conceive our second when I was dealing with all this health stuff. And I actually got pregnant like a couple weeks after the implants came out. So it was really like, okay, there was something to them. But again, how much was my diet contributing? And two, could I have handled the toxins that are in those implants better if I wasn't already purposely polluting my body with a plant such diet,
Very interesting. Yeah, it terrifies me the thought of it. Obviously, it's very tempting. We all want to be able to enhance anything and everything.
Right.
But yeah, I just like everybody that I talk to or everybody that I follow a lot of fitness models on Instagram, and they all of them almost eventually get an explant. And so it terrifies me to even consider it. But yeah, that's a very good point that, maybe it's the diet that is making that like another, it's like just another factor that's driving you over the edge,
Exactly. Yep.
I have a question. Sorry that we haven't answered it yet. TSA accenti, I guess. What about keratosis pilaris? Do you want to go for
So
it?
I'm not deeply familiar with that. If I'm remembering correctly, is it the scarring issue, or am I thinking of something completely different?
No, it's I'll tell you exactly. So it's a condition that causes rough patches and small acne-like bumps on the skin. I had a student, I remember a few years ago, who emailed me with that, and I put him on a carnivore diet, and that helped. So they'll have, like, let's say under the armpits and the groin area, you know. This condition develops when the skin produces too much of a protein called keratin, which can block hair
It's the like
follicles.
chicken skin. It's the chicken skin. It's the stuff that comes on the arm. Yes, diet first. Actually, I will even caveat carnivore on that because I have seen that clinically related to egg consumption more than most things. So that one actually, for whatever reason, eggs are really attributed to that. But carnivore minus eggs would be a great place to start.
Yeah, yeah. All kinds of skin issues from eczema to psoriasis to, I mean, vitiligo. I think Joe Rogan had a reversal of his vitiligo on literally just 1 month of a carnivore diet. So, I mean, things that we never thought could ever be influenced by diet, by the right diet, is clearly influenced to probably the biggest degree. So I think before you do anything, just what do you have to lose? Do 30 to 90 days, right? And do a strict one. Here's the thing, if you have something like that, I wouldn't do the fun, hyper carnivore, like I'll do the carnivore diet and I'll have a couple of protein shakes. It's like, don't do that if you have something that you really want to see if it's influenced by diet. Do a strict carnivore. Even eggs might be an issue. It's one of those foods that are highly allergenic for so many people, just so that you set a baseline. Doesn't mean you're never going to eat anything other than that, but just so you know, and then you make a decision and you try to introduce other things and see how you react.
Yeah, I'm with you. Yeah, the traditional elimination and challenge diet is the gold standard for finding out what things do bother you. So some people do have to stay pretty strict carnivore for really long periods of time, and some people get to be more flexible. And it all depends really what your goals are and what you're trying to accomplish. If the accomplishment is just to really try to feel good, you'd probably be way more flexible. People like Michaela Peterson, for example, she doesn't have the privilege or the ability to be able to do anything but the lion diet. And that's fine. Like, that's her journey. And people fall anywhere along that spectrum.
100%. Another question, AW Kane 22. I'm terrible at these, but your handles are also not like a full name. So, all Kane 22. What are your thoughts on sunscreen and sun damage on skin? Okay. I have a couple of thoughts. Do you want to go first, or do you want me to answer that?
I'll jump in. So we actually don't use sunscreen, and we live in Arizona. Neither do both of my children, and they're swimming in the pool right now. I can see them. They haven't worn sunscreen at all this summer. Ever. They're in the pool literally every day, sometimes twice a day, because your ability to tolerate the sun has everything to do with what your cells are made out of. So if you have cells that were built dysfunctionally with the seed oils and stuff that are prevalent in the diet, you're going to burn. And this is something that can change throughout your lifetime, right? With the amount that you consume over time. I was reading, like, the Explore page of Instagram is so funny. And I saw somebody who was like, oh, there's a conspiracy that the sun has somehow gotten hotter because I'm burning more as an adult. And I'm like, well, no, you've just been eating seed oils for the last 10 years. So therefore you are burning more. But no, I don't think sunscreen is necessary if you have a healthy diet and you are managing your sun exposure properly, right? So, like, obviously don't burn, but a tan is fine. And I think the difference there is that a burn is a pathological process. It's actual damage to your cells, right? Whereas a burn is a physiological process. It's just the stimulation of more melanin production. It is completely safe.
Perfect. Exactly what I was gonna say. Just as long as you don't burn, it's the sun burn is really what leads to accelerated aging, all that kind of stuff. So if you can figure out a way to build up a natural tan, that will be your natural sunscreen. You don't have to lather on synthetic sunscreens that have all kinds of chemicals in them, which somehow doesn't strike me as healthy for your skin or preventing aging,
It's not. I think it'll actually contribute to certain skin cancers. And then there's also the fact that our cells require the full spectrum of sunlight for health. We have light receptors on our cells. This is why things like red light therapy work. This is why you feel better when you're out in the sun. Like, it's actually, a lot of people don't know this, but it's actually this process of creating vitamin D from sunlight actually has to do with how your body converts cholesterol in the presence of those UV rays. So to say that we aren't meant to be in the sun completely negates these processes that actually exist in us naturally.
100%. Yeah. So, you need cholesterol in your skin cells so that when they get exposed to the UVB rays, then that kickstarts a series of reactions that converts the cholesterol in your skin cells into eventually bioactive vitamin D.
Yep.
Somebody, Rob Jen is asking, Accutane is AKLIEF, Acleaf, similar to this med? Derm recommendation. I'm not familiar with the drug. I don't know if you are.
I'm not either. I'm honestly not super up on the modern drugs for these things right now because it's just not, it's outside my wheelhouse.
Right. You didn't get the training to, get all of those drugs out to people.
No, a lot of my training is to get people off of them.
Exactly. Let's see. I think we covered all of our questions. I'm so glad. A question from a really old one. Sorry. I am Chepilo. Have either of you used or have patients using One Skin? It's a peptide cream. I have not. I don't know if you're familiar with that.
I'm not familiar with that specific brand, but peptide creams can be pretty cool. But the term peptide, like it can mean so many different things. Like insulin is a peptide, collagen's a peptide. We have peptides that we use in clinical practice. A lot of the peptides that are present in these new creams now are usually a copper peptide. It's a GHK copper peptide. Basically,
Okay.
it just stimulates your skin growth in a nice way. It can also stimulate hair growth too in a nice way as well. But again, it depends on what the peptide is.
Okay. All right. Let's talk a little bit about stem cells.
Yeah. Oh,
Yay.
it's my favorite.
What can we do with stem cells, and is there an application for that for reversing the aging process?
Yeah, so I forget what Florida university it was actually, but I think it was probably 2017 or 2018. There was actually a study that came out of one of them that actually proved that stem cells have anti-aging properties, which of course we can extrapolate that because one of the 9 hallmarks of aging is loss of stem cells or reduced stem cell function. Ergo, giving somebody stem cells would revert, it just kind of makes logical sense, right? But what's really cool about that is that we can actually use stem cells from a person's own body, right? You have a really great abundance of stem cells in your own fat and your own bone marrow. So harvesting something like, maybe just a stick of butter or 2 sticks of butter worth of fat from a person, processing it, extracting those stem cells, we can deliver those stem cells back to that individual intravenously, which allows them to go throughout the whole entire body, find areas of damage, inflammation, and initiate healing cycles. We see some really cool stuff. I mean, everything from reduction in pain to assisting with healing digestive disorders. I've seen people grow hair back on their head, improve their vision. I mean, so many things. There really isn't a part of the body that I haven't done regenerative medicine to, and you can use your imagination for that. It's incredible. They're super, super safe, pending the person is a really great candidate for them. So my candidacy kind of qualifications for somebody would be that they can't have any active cancer, they can't be a smoker, they can't be taking any steroid medications, not like anabolic steroids, but like dexamethasone, cortisone, prednisone, things like that. And then of course they have to be willing to stop taking any NSAIDs or anti-inflammatory medications as well. And then we also want the person to have a BMI of 30 or below. This just has to do with the simple fact that it can be really hard for the body to heal with extra adipose tissue on it because of the way that the adipose tissue itself gives off inflammatory cytokines. It really does impact what the stem cells can do as far as the healing cycle goes.
That's very interesting. Okay. Are there any potential negative side effects that people need to be aware of?
No, honestly, as long as you're a good candidate, no. So we have the theoretical effects. So the reason that cancer is a contraindication is because of the theoretical effect that the stem cells can go in, and what they do, one of the ways that they work is that they will release cytokines and growth factors. Well, one of the growth factors that they're really great at releasing is something called VEGF, which stands for vascular endothelial growth factor. There is this theoretical possibility that VEGF will increase angiogenesis or formation of blood vessels and blood flow to tumors and therefore make tumors grow.
Okay.
Of course, nobody has ever actually tested it because it's entirely unethical. You would never get funding to check something like this. But just out of an abundance of caution, we don't do it. That being said, now the stem cells, because they're coming from your own body, there's really no risk of anything like a rejection or anything negative happening. And I've personally never seen that ever.
Okay, can that be used instead of Botox for wrinkles?
I wouldn't necessarily do that because it's going to be a super expensive option. Two, yes, they can help, but you would probably be better off just doing the series of the PRP facials versus going full out for the stem cells. Yes, you totally could, but as far as like a practical example, that wouldn't be my choice.
Interesting. But maybe in the future, like they could make that technology cheaper.
Yeah. So I'll tell you what I do for faces, because the stem cells that we get come from a person's fat. What we do is I'll take out extra fat, and the way that we kind of process it, you resize it into something called microfat, or we'll call it like an adipose paste, or there's different names for it. But what it does is it actually breaks open the collagen bonds that the stem cells are within. And that basically liberates them to be able to go and do work, but it also keeps them in their food source. And this is important because stem cells are super, super sensitive cells. And if you just kind of put them into brand new tissue and they don't have their food source with them, they're just going to kind of up and die. But when we process this, we actually end up with like a really nice flowable product that we can inject pretty much anywhere. So I'll actually do facial injections in the same way that you would do filler. So we can do cheeks, we can do nasolabial folds, we can do lips. And this is like what basically a fat graft to the face with liberated stem cells so that you will actually grow nice new tissue from a stem cell based level of regeneration while also giving you same day plumping. And really, really beautiful results too, and so natural because it is your own fat.
So you can literally plump up your lips with stem cells.
Oh yeah, we can take some, fat from your lower abdomen or your love handles, pop them in your lips, and you're going to get the plumping again from the fat just being transferred in there. But then the stem cells are going to make new tissue over time too.
And do you have to redo that procedure, or for how long does that work?
So stem cells will continue to regenerate for anywhere from 6 months to a year. So we just know based on the literature that that's how long they can work for. That being said, the healing that you get is yours to keep. So just like if you've ever gotten a cut on your arm or something like that, like once that cut's healed, it's not just going to randomly reopen. Like the healing that you got was yours to keep. So whatever work the stem cells do is going to be yours, pending, of course, the other natural just aging process that you're going to go through. But it's not like they're just going to like go away.
Wow, this is fascinating stuff. Everything regarding stem cells, I feel like I have a gazillion questions.
Oh, we can dive in. It's my favorite. So I love stem cells so much. Like I've just seen such cool stuff over the years being in this industry. And, obviously we love seeing powerful changes, right? Like I think that's one of the things that attracts us to just carnivore in general is the powerful changes. Stem cells are the same thing. Like the fact that somebody can come in, see me for one appointment, we work together, we do all this stuff, and then they get profound healing. Like it's one of the coolest things. And especially when it comes to conditions where there isn't a really great conventional option for these people. So whether or not they have some sort of chronic pain picture where surgery is not an option or they failed surgery already, those are kind of like my favorite patients to work with because, well, now we get to heal you, right? Surgery didn't work. The pain medications you're taking aren't work, but we can put stem cells in there to actually heal up the area and we can get you better.
Wow. That's amazing. Okay, I got a question. Rob Jen, thanks for bringing up kids. Recommendations for kids' diet, keto carnivore, especially dealing with acne and another asthma.
So we have kids, my husband and I, they're 4.5 and 1.5, and they are both they're both definitely hyper carnivore. The youngest guy is like almost super carnivore. Like we've done experiments before where we've given him like a piece of meat and like a strawberry. He goes for the meat every single time. Like his palate, because we started him basically as soon as he came off breastfeeding, he still kind of is though. But he's so purely carnivore. Starting the kids on this, like you just have to do it. You have to lead by example, first of all, because kids will do what you do, not necessarily what you say. So we make it a point to like sit down and have the family meal. And a lot of times we'll do just like a family grab all tray of just like food we've popped on the grill. So we'll pop on like some steak, some salmon, some chicken, and just have it on like a big board, and everyone just kind of has what they want from it. I think that that's fun too, because it allows them more flexibility of what exactly they want to pick from. So they're not just combined, like bound to one thing.
Yeah.
But it does take some time, because at that age, I mean, kids in general are just in such a state of growth. Like all their body wants to do is grow, 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 grow. So the caloric demands, and of course the brain demands with that as well. I mean, the brain, of course, wants to run off of fat, but it really still loves sugar as something to run off of. And when you have these teenage brains or these young brains, like they're going to want to go for that quick energy, because that's what their body is demanding. So you either have to have a lot of food or like a really great strategy for feeding them consistently, so that they don't have the space in their like hunger throughout the day to go for those carbs.
Yeah, and that's the thing. It's like once they taste sugar, then you gotta do what you're doing right now, right? Unless you have like Kelly Hogan. I don't know if anybody is familiar. The way that she did it is that her kids haven't even tasted sugar, so it's a lot easier. If they've never ever tasted sugar, they don't develop the taste, the craving for it. They even go to like birthday parties, and she'll make them like a special carnivore cake that literally has no sugar in it. It's like cream and vanilla extract. Yeah, it's crazy. It's called Oopsie cake, I think. I don't know.
I'm gonna have to look that up. That sounds great.
I interviewed her on my channel, so if you check out the interview between me and her and drop down to the description box, I posted a link that takes you straight to the recipe. I think it's called the Oopsie cake or something. Yeah.
Love it.
Yeah. All right, let's see. Ooh, any tips on first signs of varicose veins in legs? Sunshine Dutch.
Diet. Varicose veins really strongly related to plant anti-nutrients.
Really?
Anything that's basically tackling the integrity of the blood vessels, for sure. Yep, try carnivore, switch to carnivore.
Wow, there you have it. Okay, before Frenchie's question, I have another question that I went over. Somebody asked us about PCOS and trying to lose weight. Let's see.
Carbs have to go with PCOS, and yeah, that's
the thing.
That is what it is.
Plus calorie deficit, and I really want to. I always take. I always make a special effort to focus on how important it is to create that calorie deficit, because I feel like almost all the clients that I get are so frustrated because they've tried to do carnivore and they just hear like, just eat, and the cravings will go away, and that will work for some people, but there are a lot of people that won't work for them, so we can eventually transition into that intuitive eating on carnivore, where you can remain lean and fit without having to track and obsess over calories. But for most of my clients, it's just not gonna work, especially at the beginning when you're getting them from a history of eating disorders, all that kind of stuff. You need to know how many calories are found in all the major carnivore foods, because we wildly underestimate how many calories are found in those foods, and we wildly overestimate how many calories we're burning. And so people think they're in a caloric deficit. They don't realize what it actually takes to be in that caloric deficit. So you need that caloric deficit, and you need to cut out the carbohydrates.
I agree. And to add to that, so like you were saying, so people who actually come from a background, I'm sure you've seen this, where they've done a lot of dieting, possible eating disorders, and their metabolism is somewhat broken. Like even if they were to consume a quote unquote healthy amount of calories in a day, they either wouldn't lose the weight, they would stall, they would feel terrible. And I've worked with this on patients a lot, is that you actually have to retrain the metabolism. And sometimes that does mean, we'll call it overfeeding you, but it's not really, but it's reminding the body that it's actually in an abundant state, right? Like there is actually enough food coming in that it doesn't have to feel like it's starving and need to hold on to everything that you're giving it. And sometimes that there can be a little bit of weight gain in that time period. And I tell people not to worry about it because again, we have to retrain the body. Like the time's going to pass anyway. We will get you there. We need to do it in a healthy way, at least to some degree, right? And not everybody needs that, but women who have a really big history of losing the same 10 to 20 pounds multiple times, their metabolism is usually broken and needs some work.
Yeah, you need to go through a reverse dieting phase. And I know you posted a bikini competition. So, you know, like I know where you're coming from. That's exactly also where I'm coming from, is that after every weight loss phase, like the one that you've gone through, like all the fitness models have gone through, they're very careful not to go back to maintenance because we don't know what your maintenance calories are after that caloric deficit. Your maintenance have dropped down, but we don't really know exactly where. So we have to very slowly start bringing up the calories, and ideally you want to do it just with protein. Just bring up your protein grams for a period of time and see how your body responds, just to figure out what that maintenance is. And it can take a couple of weeks, really, sometimes a couple of months. It really depends. And that might be absolutely essential if somebody has had such a slow metabolism and it's like an extreme case. They might have to just take a few months and reverse diet before we go into a cutting phase, unless they are willing to just work out 5 hours a day. We can still like get you there, but even after that, you know, then we also want to do a reverse diet to now maintain it, you know?
Agreed. And then, I mean, I will add that there are a couple other reasons why people might be resistant to losing weight. At least what I see clinically is that we kind of like alluded to this earlier, but your fat tissue is actually an endocrine organ. So it's a source of both hormone production and then also hormone, it changes different hormones to each other, right? So it can convert like your testosterone to estrogen, for example. This is why we see middle-aged women who hit menopause start to put on what we call like the spare tire right around their midsection. It's because your body's trying to create more surface area to make more estrogen, because your estrogen production went away when menopause hit, right? So there could be a hormonal component that is playing into that, especially if something like that applies to you. And then the other reason is that there could be, your body could be trying to dilute toxins, right? So if you are being exposed to toxins on a daily basis, such as anywhere in your environment, whether it's your beauty products or your place of work or whatever it is, your body's solution for pollution is dilution. So it will actually put on more adipose tissue as a way to store those toxins, because your body's going to have a hard time. Your body's, for whatever reason, is having a hard time eliminating them. So again, if you are having weight loss resistance, looking into possible hormonal issues and toxin issues can possibly help be the thing that moves the needle, in addition, of course, diet and exercise.
Love that answer. Thank you so much. We've got one more question. T.S. Accenti. What top foods to gain weight and muscle? Do you want to take it?
Oh gosh, I mean, if you wanted to just binge on carbs, that'll put weight on you. But to gain actual muscle, you need to eat the muscle to gain the muscle. Like you should have protein in your diet to be able to build more muscle. It's just one-to-one, but I mean, you're the PhD in exercise physiology. You go.
Yeah. No, I was going to say the exact same thing, that the carnivore diet people associated with weight loss, just because the vast majority of people who find it come to it wanting to lose weight. But the truth is it's not just a weight loss diet. It's a weight normalization diet. So I've had interviews with people who are very underweight and tried to gain weight on paleo and other kinds of diets, and it wouldn't work. And it was just the carnivore diet that makes them be able to hold on to the muscle and put on that muscle, because protein is anabolic. It stimulates the body to build muscle, right? It's an anabolic trigger. And so the more meat you're consuming, the higher the likelihood that you're actually going to retain that muscle, because you're sending the right messages really to your body. So yeah, carnivore, and just don't be in a caloric deficit, because that's another thing. So just struggling to put on muscle, and make sure you know the math and the amount of calories you're burning and how many calories you should be consuming. You don't want a crazy excess. I'm not pushing that. I'm saying just don't be at a deficit. And maintenance, or maybe an extra 100 calories over maintenance at best, plus really hard, intense training. Like you gotta suffer in the gym. I'm sorry, but it's hard work. Yeah.
Yeah, the muscle breakdown isn't, you can't overlook that. Otherwise, you're not going to get that hypertrophy that you're looking for. So it's not just, waltz in and like do a couple little weights. Like you really have to be breaking down that muscle and then fueling it appropriately and then resting appropriately.
Exactly. Exactly. Recovery is equally as important. Yeah. Get your sleep, everybody. Wow. So thank you all. I wanted to ask you more things, but I feel like maybe we should do a part 2 so that we keep them in like manageable chunks. Because I'm gonna save this and put it on my YouTube channel.
Yeah.
One more question. TSX Sensei, I can't help myself. What about protein powders? So ideally I recommend collagen if you must. You don't really need to, yeah, right?
Yeah.
I have like the collagen Great Lakes, I think it's called. If you're eating enough protein all day long, you don't need to take a shake or make anything. Like the optimal diet is again just meat, But I get that not everybody is as strict. I'm not even that strict. Like I just mentioned, I'll have shakes sometimes. So it's okay. It's fine. They don't have plant toxins as long as you're not reacting to dairy, because a lot of people have reactions. They don't even know it, that depression, anxiety, skin conditions, they don't realize they're just reacting to the dairy. So
I agree. And sometimes like with the shakes, some days, like, I don't know about you, but I just don't want to chew anything. Like I'll just like, I'll have a texture day where I'm just like, you know what, instead of like making something, I'll just have this shake. And I'm with you. I do pretty much collagen shakes only. I just find that it's going to serve me better for where I'm at right now. But there are, certain people that can handle whey protein. But there's also bone broth protein that's available. So that's an option for some people as well too.
yeah. Yeah, there's also, I think, beef protein powder. So there's all kinds of like, you can't carnivore-ish. Just the thing that you also want to remember is that they might be pumped with artificial sweeteners, artificial dyes. So it's not like a health food. So if you have a serious condition, or if you don't have any condition, but you just want to optimize aging and you don't want to age quicker, then just do meat. But, yeah, I think we covered that. Thank you all. Thank you, Dr. Solt. I still want to ask you questions, so I'm definitely going to set up something soon. Maybe we'll do it for YouTube next time.
Yeah, we'll definitely do part 2. And I mean, I'm sure people will definitely have more questions after this, and we can kind of compile those and just like
there you go. What's next for you, Dr. Solt, or what is it that you're working on right now?
I'm actually launching quite a few things right now. Within the next week or so, I'm actually going to be having the ability for anybody, basically in the United States, there's a couple wiggle places where it's not going to be okay, but where people will actually be able to go to an online store that I'm going to have and order lab testing. And have me be able to do an actual report for you with recommendations. And I'm actually going to have panels specific to carnivore, which I'm like super pumped about. I really sat down and I was like, I need to make this, because I see in these groups all the times where people are like, I don't have a doctor that gets it. I don't know how to read these labs. Nobody's telling me what it means. I need to be able to check this out. So I have one that's actually going to be hormones and micronutrients. And then I have a specific to carnivore. And then I have another one that's going to be actually cardiac and blood sugar, specifically related to carnivore. And then there's the third option, which is the two of them combined. So it's like many pages of data, plus a personalized report from me with all the recommendations that I would say that you would probably need to do, again, in line with carnivore. There's going to be other non-carnivore stuff on there as well too, just like general hormone panels, gut dysfunction tests, food sensitivity tests, things like that too. But I'm really pumped with that because, I mean, anybody's going to be able to work with me at this point, which I'm super excited about. Then I'm also launching group programs for men and women, so those should be launched within this quarter for sure. And then I'm coming out with a supplement, which I'm not revealing it yet because I'm just not revealing it yet, but I'm really really excited for it. So I'm pumped for that.
Oh, that's amazing. Okay, I definitely, once all these things start happening, then you're going to update us. Maybe we'll talk in depth more about the labs too. So I'm so excited for you and for the carnivore community. I'm so glad that it's growing and we're having all these amazing people just finding so much healing, and we're figuring out how much more control we have over our health and our happiness that we never thought we did. So that's amazing. Awesome. Thank you all for joining us. Thank you, Dr. Solt, for today's IG Live. I hope this was helpful, and this is for the YouTube folks. If you like this video, make sure you give it a thumbs up, subscribe, and hit that little notification bell icon so YouTube alerts you every time I post a new video. Thank you all for watching, and I will see you in the next one. Bye.
Hi, everyone.